So October 9th, that was the day that, my last day that I ran. That's when I ran on my own, went too far into the woods, and something told me, like, turn around. And I remember two nurses on either side of me, and they gave me sedation, and they said, you're gonna go for a little ride. I said, turn your head, and they defibrillated me there. I don't know if I had much of a name for it. Back then, I just knew I had supraventricular tachycardia, and I know that was like the scary stuff. They tried different medications, they weren't working, and so we were running out of options, and so then they introduced this defibrillator, and they told me it shocks the heart when it gets too high and brings it back down, and so I had a lot of anxiety with that. I looked at everything so differently, and I was constantly afraid of getting shocked. Is it going to happen when I'm sleeping? Is it going to happen when I'm driving? Yeah, that was a very, very lonely, very, very scary time.
Ultimately, ARVD or ARVC was diagnosed as the cause of her ventricular tachycardia. And initially the focus of treatment was on preventing sudden death and treating these cardiac arrhythmias. Back then we didn't know that it's important to restrict exercise when you're first diagnosed, and she continued running. Well, we now know that if you continue exercising once you get the disease, your risk of heart failure and needing a heart transplant goes up even further.
Well, today I'm getting a right heart catheter, so I go in and make sure everything's working and functioning.
ARVC is arrhythmogenic right ventricular cardiomyopathy or dysfunction. And it's a unique situation where the right ventricle becomes very, very dilated over time and dysfunctional. There really isn't any other treatment aside from a heart transplantation when it gets into its end stages. Kristine is a very special individual. She waited in the hospital for several months and probably had the most energy I've seen out of anybody. Sometimes as a result of patients' either genetics, disease process, or as a sequelae of their heart disease, other organs can become dysfunctional. And for her, this disease process had taken a toll on the liver as well. And ultimately, the best thing for her and the safest thing for her was a combined heart-liver transplantation.
When the heart doesn't pump blood well, blood backs up, and it backs up directly into the liver, and that's not good. The liver gets congested. If the heart is restored quickly to good function, the liver can recover. If the liver is subjected to that congestion for months or years, the damage becomes permanent. Heart-liver dual transplantation is very unusual. You're taking the most complicated procedure Johns Hopkins does, a heart transplant, and you're combining it with the other most complicated procedure Johns Hopkins does, a liver transplant. In fact, very few of these have been done in the world. We have to have a donor that's an appropriate heart donor, but is also an appropriate liver donor. It's got to be perfect. The planets have to align.
Ready to inject.
The night of the surgery, I remember we did like a little parade out of my unit into the surgical unit, and then everything was pretty quick. They put me under, and then I just remember waking up, the doctors telling me, you did really well. When I first had it, I almost couldn't sleep. It was so loud and so powerful in my body, and it was just amazing. I was like, turn it off, turn it down. It was just crazy. And it's amazing. I go out and I jog. I try to jog a little bit, I'm working up to it, and I'll get to this point where I'm just flushed, and back before, I'd check my pulse and I could feel if I was in a tachycardia. And now I'll check and there's no extra beat, it's not up real high and then coming down, it's normal. Now, without the defibrillator and without the ARVD, there's so much I want to do, just there's no limit to what I can do and what I want to do, and so the list can go on. It's fabulous.